afternoon and welcome to this Facebook Live event. Today we're going to be talking about attention and attention deficit hyperactivity disorder, or ADHD, particularly in relation to children who have been born prematurely. My name is Carly Trevaux and I'm a senior lecturer and psychologist at La Trobe University, and I'm also a part of the Centre for Research Excellence in Newborn Medicine. The Centre for Research Excellence in Newborn Medicine and our partners, Life's Little Treasures Foundation, are really very delighted to bring you this session today, this Facebook Live event. This is the third Facebook Live event in our Prematurity Roadmap series, and it'll primarily be a question and answer session. Before we get into the questions though, we're going to go through a little bit of general information first. We invite you to ask questions through the Facebook page, and you can do this in two ways, through the open comments section, or you can send us a private message. We're going to try and answer as many questions as we can in this hour, but from past experience we know that we probably won't get to all of them. So after the session, straight afterwards, we're going to be trying to answer the remaining questions on our Facebook page. Because this is a public forum, we'd just like you all to remember that we need to be mindful of privacy. So if you're sharing stories of yours or other people, just be mindful of privacy there. We also just wanted to remind you that all the information we're going to be talking about today will be provided as general information, and if you have any concerns about your child's health, well-being or behaviour, to please speak to your GP or a health professional about your concerns. So let's meet our panel. Welcome, Emma.
Hi. Hi everyone, my name is Emma Shabiris. I'm an Associate Professor and Clinical Psychologist at Deakin University and the Murdoch Children's Research Institute. I've been working in the area of ADHD for about 15 years now.
Welcome, Peter.
Thank you, Carly. Hello, everybody. My name's Peter Anderson. I'm a psychologist in the Centre of Research Excellence in Newborn Medicine and also Professor of Paediatric Neuropsychology at Monash University. I've been doing research with children born very preterm for over 20 years, looking at their long-term follow-up. And a particular interest of mine is trying to work out why some children have difficulties such as ADHD and others don't.
Welcome, Christy.
Hi, thank you. I'm Christy, and I've got a daughter who was born premature, and she's also been diagnosed with ADHD.
Thank you. And welcome, Anthea.
Hi, I'm Anthea Rhodes. I'm a paediatrician and I work with children and families with developmental problems, including ADHD.
Thank you. So just before we get into some of the general information, I just wanted to have a quick chat with you, Christy, a little bit first. Could you just tell us a little bit about Penny's birth and her early neonatal care?
Yeah, so she was born at 35 weeks exactly, and at the Royal Women's, and she was in hospital for just over a week in the special care unit.
Okay.
Yeah.
And what about Penny's early development? Can you tell us a little bit about that?
Looking back, I think I always knew that there was something, that she was a little bit more active than a lot of other kids. Mm-hmm. She could definitely run around for a lot longer and a lot faster than a lot of other kids. Yeah, looking back, I can see quite a lot of traits. Mm-hmm. She was diagnosed officially, though, when she was 7 in grade 1.
And when you were talking about that diagnosis, can you tell us a little bit about the path that you and your family of ADHD for Penny? Yeah,
so in prep, I was quite concerned about her lack of ability to read. Mm-hmm. It felt like a lot of other kids were taking off, whereas Penny was sort of struggling to make it all work. Mm-hmm. And then it was sort of suggested by one of the teachers to do an assessment, and I was quite open to that. Mm-hmm. And that was what followed in grade 1. Towards the middle of grade 1, we got an official diagnosis and proceeded to a paediatrician for a full treatment plan.
Okay.
Yeah.
Okay. Thank you for that.
That's okay.
So now we might start going through a little bit of general information. I think, just hand this. Okay, so I think Anthea, you're first.
Sure, thanks. So I'm just going to talk very briefly a little bit about what ADHD is so that people tuning in can have some understanding. Essentially, it's a neurodevelopmental condition. So when we say that, we mean it's a condition that affects a child's brain and the way that that develops, and in turn affects the way they function. And in particular, it can affect their concentration and the way they deal with things like impulses, their levels of activity. It's important because it can affect the way a child functions. And in particular their learning and social skills. ADHD is actually quite common, relatively common, with 1 in 20 children in Australia having ADHD. And importantly, the exact cause of ADHD is really not known, and obviously we're talking about it in the context of premature birth and babies today, but there's likely lots of factors that are both genetic, so come from the family, and also environmental that have a role in what actually causes ADHD. And I think it's important to acknowledge that it's not the result of bad parenting, which is often something that is talked about, but it's really much more complicated than that. So there's no single test for ADHD, and those of you listening who've had an experience perhaps with your own child will know that assessment often requires several steps, and we've heard about that from Christy, and gathering information from lots of sources, so parents and often teachers, or perhaps childcare or kindergarten teachers if that's where your child is attending, and putting all of that together in a formulation to see whether that child's pattern of difficulties looks like it fits with a diagnosis of ADHD. And so then, in terms of formally making that diagnosis, there's actually a series of criteria, and that's what the people looking at a child thinking about whether they might have ADHD assess to decide whether or not they make a formal diagnosis. That's quite complicated, and I won't get into all the nitty-gritty and the details of those criteria, but the important things for people to know are that they include a persistent pattern of function, so something that behaviours that continue over a period of time that's not just short, but many months, or at least 6 months generally. They can include patterns of behaviour affecting attention, specifically inattention, or more to do with hyperactivity and impulsivity. And those behaviours need to be present before a child is 12 and in more than two or more settings, so not just at home or just at school, and importantly interfering with the way they function, and we'll talk a bit more about that. There are different subtypes across those categories, so whether you are children are having more trouble with attention or perhaps more trouble with their activity, or a combination of both of those things, can determine different subtypes of ADHD, and they can present differently. So importantly, and particularly if you're listening and thinking about your own child, or watching and thinking about your own child, some of the things that might be present where a child has hyperactive or impulsive symptoms include some of these things listed here, and I won't read all of them out. But importantly, things that suggest a child is not able to sit still or not able to control their impulses, and doing these things outside the range of what would be typical, or what we sometimes call normal, for a child of that age and developmental stage. And that's where having people understanding what's normal for behaviour and looking at a child compared to that helps to decide whether a child really does fit that diagnosis of ADHD. The inattentive symptoms sometimes are a little bit harder to spot, and particularly a child who has inattentive subtype, so doesn't have that hyperactivity, can find that it's a bit longer before a diagnosis is made. So these are some of the signs and symptoms of inattentive type. So they relate to things like having trouble concentrating, perhaps a child might be disorganised or very forgetful, not able to follow instructions. And again, all of those things need to be outside the range of what would be typical for a child of that age and their development. I think Emma's going to talk a bit more about some of the things that can look a bit like ADHD or exist alongside ADHD.
Yeah, great. Thank you, Anthea, for that really great overview. So ADHD is really complex. In about 70% of cases, children with ADHD will present with 1 or more additional difficulties. And these are really important to understand at the point of diagnosis, and also when thinking about the treatment plan that you might be engaging with. So, for example, a number of children with ADHD will have difficulties with language or learning, and so that will need to be factored into the classroom environment in particular. children with ADHD can also present with an autism spectrum disorder or even high levels of autism spectrum symptoms. So thinking about how that might be related to some of the social difficulties that a child might be experiencing is important to consider too. It's probably most well recognised that children with ADHD can present with disruptive behaviour difficulties, and about 50% of children with ADHD will have challenging behaviours that can be really tricky for parents and teachers to manage. But also sleep problems is something else that can occur alongside ADHD, as well as anxiety and mood type difficulties, and sometimes they can go under the radar for kids with ADHD because they aren't as observable. So a good assessment for ADHD should be considering all of these factors, and in order to really help children to have the best outcomes, thinking holistically about not only ADHD but some of these other factors in treatment planning is important. ADHD is actually one of the most well-researched conditions of childhood, and it's actually, if you look back in history, it can be traced to the 1700s, so it's not a new condition at all. It's something that's just had different names throughout history. ADHD can have a huge impact on life, but it's important to note that many kids with ADHD go on to have pretty good outcomes, but on average these kinds of things here can be more difficult for children with ADHD. So one area that kids can struggle with is their peer relationships, so they might have more difficulty making and keeping friends than other children of the same age. Academic difficulties can also be present, and this might include things like, was mentioned before around reading, but it might also be maths or even the way that the academic environment is approached. So difficulties with organisation, time management, getting homework done, for example. In terms of families, it can be really hard for families to manage some of these behaviours. So if you're managing and trying to deal with really high levels of activity and distractibility 24 hours a day, especially when there are sleep problems present too, it's really, really hard. So as Anthea said, there's no evidence at all that bad parenting causes ADHD, but it can certainly make things more tricky in the family environment. There are lots of things that we can do to help children with ADHD. And I think the first really important thing is having good understanding of what ADHD is, and your overview, Anthea, is perfect. So I think understanding the kinds of symptoms that you'd expect to see in a child with ADHD can really help to make decisions about how you might manage that behaviour. So the lens, I guess, in which we see children's behaviour through is really important to thinking about what we might do to help them. So there are a number of different strategies that parents and teachers can use to manage challenging behaviours, and we'll talk more about this throughout the session, but thinking about lots of structure and routine, really getting a good understanding of the individual strengths that child has, because all children have strengths, but there's likely to be particular situations that are pretty difficult, and that if we have a good understanding of those situations and try to preempt them, that can also be a good way to contain some of the challenging behaviours. Particular education strategies can be helpful too, so thinking about whether or not an individual learning plan is needed, having regular communication with schools, thinking about particular things in the classroom that might help a child to attend better. And medication is another treatment approach that has been widely researched, and it has been shown to improve the main symptoms of ADHD, including the inattention and hyperactivity symptoms that we might see. But we see all of these other treatment approaches as being important too, and particularly for helping with some of the more social and academic aspects that might be affected in ADHD. But as I said before, it's really important to consider whether there are any associated difficulties that are present and how to factor those into the treatment plan. Okay, so I'm going to hand over to you.
Yep, thanks, Emma. Right, so as many of you know, inattention is a core problem for children born very preterm. It's one of the common issues reported by parents and teachers. And when we speak to health professionals in the community, many of them report that children born very preterm have higher rates of ADHD. And in the last couple of years, we've seen some reports which actually support these anecdotal reports. And we now know that the rate of ADHD is 3 times higher in children born very preterm than children born full term. In Victoria, we've been following up children over many years, and we've found that the rate of ADHD in children born very preterm is 4 times the rate of children born full term, with about 11% of our children born very preterm having a diagnosis of ADHD. It's been suggested that the inattentive subtype of ADHD is more common in children born very preterm, and that appears to be the case as the children get older, but definitely in the younger children they also have symptoms of hyperactivity and impulsivity. We know that ADHD is more common in boys, but when we compare very preterm boys with full-term boys and very preterm girls with full-term girls, we find that the increased risk for ADHD is equal for boys and girls. Now, I think it's really important for us to stress that the vast majority of children born preterm and very preterm do not have ADHD. But there are many children who are born preterm and very preterm who have symptoms of inattention and impulsivity who don't meet the threshold for a diagnosis of ADHD. And these children have these symptoms can actually cause problems academically and socially, which do warrant close monitoring of these children and in some cases support. We don't know exactly how many children do have attention problems, but we do know that it's a significant proportion of children born very preterm. As has already been indicated, we don't really know what causes ADHD. It's a combination of genetic and environmental factors, and we also don't know why preterm birth is associated with an increased risk of ADHD. But we assume that it's an event which has happened to the brain during a critical period of brain development. Children born preterm are born during a period of very rapid brain development. In the last 10 weeks of pregnancy, the brain increases in size 4-fold. And during this period, children born very preterm and preterm are in hospital, in intensive care often, and are being often treated with very powerful drugs and being exposed to stimuli that their neurological systems aren't yet ready for. So these children are vulnerable for ADHD as well as other neurodevelopmental disorders such as autism, learning difficulties and so forth, although the vast majority of children do not develop these problems.
So, Anthea, I was just wondering if you could tell us a little bit about where could parents go in the first instance if they have concerns about their child's attention behaviour?
Yeah. So I think obviously a family doctor or GP is a great first contact and port of call to have that conversation. Mm-hmm. It's also really helpful to perhaps have a chat with if your child's attending school or kindergarten or even childcare, have a chat with the workers that are spending time with your child as well, mm-hmm. and get a sense of how they feel your child is functioning, because they'll have a really good idea of what's typical for a child of that age and developmental stage. Mm-hmm. So I often talk to families about how, if we took 100 2-year-olds, they'd probably all be hyperactive. So some of those behaviours are very normal at certain ages and stages, and then they become less what we would call normal or typical as children start to develop, and we expect some of those behaviours to go away and become more regulated. So I would encourage parents to have a chat with other people who spend time with their child, if they're comfortable doing that, to get a sense of how their child functions in those environments and whether they might have some concerns as well, and then to take those concerns and talk about them with their local doctor.
Okay, thank you. So we do have some questions that have come in through the email already. And these questions are from a mother who had a baby born at 34 weeks and was wondering whether or not babies who are born in that later stage of gestation might also have a greater risk for ADHD. So Peter, maybe you could talk to me.
That's a very good question. Most of the studies that have looked at ADHD in preterm children have focused on children born very preterm. What they've found, however, is that the children who are born at the extreme end of prematurity, those born less than 28 weeks of gestational age, for example, their rate of ADHD is higher than children born more mature than that. So we would expect that while we don't have good information about what the percentage of children born late preterm develop ADHD, we would expect that it's somewhere between the population percentage, which is around 5%, is that right? Mm-hmm. and probably around 10%, which we would expect for very preterm children. So I'd expect it to be somewhere around 5 to 10%, while we don't have the exact numbers at this stage.
Thank you. So Anthea, you touched on this, but we've had a couple of questions about parents wondering where that line is between typical activity for a young child in particular and when it might be something more concerning. Do you have any sort of extra tips on how parents can
I think that can be really
answer
hard,
that?
and I think there's lots of things that parents sometimes do to try and understand that. We think about gender, it might be a boy thing or a girl thing, or we sometimes compare one child to other children within that family or perhaps their cousins to try and get a sense of whether this is normal or not. I think what is really helpful for parents is to try and think a little bit about their child functioning, and what that means is, you know, getting on with the core business of day-to-day life of being a child. And for a young children and older children, that's about forming friendships and being able to interact and play with others in a way that is functional. It's about learning, and whether that's in a school environment or learning through play for younger children, and doing those sorts of things in a way that allows them to keep up, you know, and not cause them lots of trouble all of the time. So where a child is having difficulty with that, so perhaps their behaviour makes it really hard for them to make and keep friends, then that could be a red flag that this is not typical and it needs to be looked at. Where they're really finding it hard to perhaps learn in the classroom and where usual level of help is not quite enough, again, that could be a red flag. And where parents are worried, I would just say really encourage them to have a conversation early with a healthcare professional about their concerns. Yeah.
Thank you. So another question that's been asked has to do with age at a diagnosis or assessment. I'm not sure, Emma, whether you wanted to talk to what's sort of the earliest age that ADHD can be diagnosed in a child, or is there an age range?
Yeah, so ADHD is most commonly diagnosed in primary school. And the reason for that is that, as Anthea was saying before, one of the key things we look at is how ADHD is impacting on the day-to-day functioning of kids. And the two main areas that we think about are social relationships and academic functioning. And it can be harder to get a handle of the impact of ADHD at those younger ages. So usually kind of from 5 onwards, we'd think about a diagnosis of ADHD, but in some cases where the ADHD might be very severe, you can make a diagnosis earlier, and certainly I've come across some of those cases before, and I'm sure Anthea has too. But that would be in a situation in which there really is clear evidence that the symptoms that you're seeing are much higher than you'd expect for children of the same age, and also that their impact is so high that treatment is warranted.
Great, thank you. Some of the other questions, or there's been another question asking about whether or not there's been any research or links between ADHD for babies who are born prematurely. Peter, I might direct this to you, who were also prescribed caffeine to treat apnea.
Oh, good, interesting question. Caffeine is prescribed a lot to, in particular, very preterm babies. There has been a long-term trial looking at the effects of caffeine, long-term effects on the child. And while we didn't specifically look at ADHD, we did look at behaviour problems. And the children who received caffeine, in comparison to those children who did not receive caffeine, did not score any differently in terms of their behaviour problems, both in terms of external type behaviours such as aggression, conduct problems, as well as or internalising problems such as anxiety and depression. So based on that, I would think that there's no link between the administration of caffeine and ADHD.
Okay, thank you. So we've had a couple of questions actually from parents wondering whether or not there are things that they can do if they are concerned, or that could help support their children before, if they're starting to notice some difficulties. Christy, was there anything that you, what were, I guess, the first sorts of things that you did when you noticed that you were becoming concerned about Penny's attention?
I think not limiting not being restricted by stigma and actually seeking out more information. As soon as we did receive the diagnosis for Penny, I went and researched quite a lot. But I think it's quite important to remember to stay looking at actual research that does have data to support it. I think there's a lot of misinformation out there, especially in regards to medication and different treatments, different therapies. So I think get onto it early. That's my best advice. And don't be ashamed. Don't be scared to get that diagnosis. There's amazing people out there with ADHD, so it's definitely something that can enrich your life more than take away from your life if you let it.
Thank you. Did Anthea or Emma, did you want to add anything else about things that parents can do when they're beginning to be concerned?
Look, I think what you said is fantastic. I think getting help early, and I think, you know, it can be really hard to find the best information, and you know, there are really good resources on the Raising Children network that summarise what ADHD is and the kinds of treatment approaches that have been found to be most effective. So having a look at those, and I think you touched on another really important point, which is that idea of really understanding what ADHD is, and I think doing as much reading as you can there, and I think, you know, really thinking about what the strengths are and staying with some of that can really help to get through it, because a lot of the behaviours, I guess, that you're seeing, they can be really challenging, but some of them can actually be really, the kids are really fun to be around. And so that's probably one of the reasons I've worked in the area for so long, because I've worked with so many great kids that have a real spark and energy to them. And so I think really getting to see some of those positives can help with managing the difficulties that you're facing in some other parts of the day. So.
And I think just echoing the idea that you mentioned the concept of stigma, and I think I often find when parents come to see me that it's often been a long road. You know, they've been thinking about this for ages, and they've been kind of wondering, is it me, and is it the way I'm parenting? And they may have even had input along those lines from people, and they're feeling sort of really nervous about actually stepping up and seeing someone about it. But also, as soon as we do that and we have that conversation, there's a lot of relief, and they feel like, you know, there's a pathway forward. And sometimes they're saying, I should have done this ages ago. And I say, don't start feeling guilty about that now. But, you know, and that it's really common. And you do need a while to get to the point where you know it's right for you to seek help. But if you feel like you're there, I really would encourage people to reach out, because I think mostly that's a positive experience then.
I think that people thinking that it's bad parenting is probably the biggest hurdle that you have to get past, and that's something that even I think 3 years on, I'm still dealing with sometimes people's perception of other children who I've identified possibly have ADHD, and they say it might be something to do with the parenting, and it very rarely has it got anything to do with the parenting.
Thank you. We've had a couple of questions wondering about, I guess, differences, or if you have a child and you're not sure whether it's ADHD or perhaps autism spectrum disorder, sensory processing disorder, and also someone asking about what the difference between ADHD and ADD is. So what advice could we give to parents about some of these symptoms that might, you know, what might they represent, or how do you go about sort of untangling those different areas?
Yeah, it can be really challenging to make some kind of clear decisions about whether, you know, something is ADHD or an autism spectrum disorder. But a good assessment for ADHD should consider all of these other things. So often in my clinical work, I'd receive a referral that might just mention, you know, inattention and hyperactivity. But as part of the assessment I would look at all of those other things too. And, you you know, there are some children that can be diagnosed with both ADHD and an autism spectrum disorder. So I guess when we're thinking about an autism spectrum disorder, we're really looking at more of a pattern of kind of difficulties with social communication, really understanding social cues and the intricacies, I guess, of social relationships. So there's nothing to say that you can't have that as a difficulty, and you can also have inattention and hyperactivity as a difficulty too. So I think that's the first thing. You don't have to, it's not a clear-cut decision. And that applies to other things like, you know, anxiety and the overlap with ADHD too. You can consider both things. I guess in terms of the question about ADD, so that's a term that is used to describe the inattentive type of ADHD that Anthea referred to. So in that situation, we'd be looking at a child that has more of the difficulties with organisation, concentration and so on, and not so much of the hyperactivity or impulsivity difficulties.
It hasn't got the H for hyperactive.
Yeah.
So yeah, it's really just about inattentive type. Yeah.
Great. Thank you. We've had another question through email wondering about a child who's now a teenager, was born at 28 weeks and was diagnosed in early childhood with ADHD. In terms of when we're moving into adolescence, I'm wondering if we could discuss what ADHD might look like over time for adolescents, you know, moving on from childhood, and also what parents can do for the adolescents who might have ADHD as well.
I'm happy to speak to that
Yes,
a bit if
Anthea,
you like.
that'd be
So adolescence include often patterns of perhaps a bit of defiance that is in an attempt to gain independence. There's some risk taking as young people learn what boundaries look like and what consequences mean. And all of those things in the setting of an individual who has difficulties with good decision making and impulse control really can make for a heightened picture of some really difficult behaviours and challenging times for families. And what we sometimes see is, and we get back to that idea of function, is that impact on their friendships and their social relationships, where they might not read cues well, they might be making difficult or poor decisions that are a bit impulsive, and that might make individuals around them feel really uncomfortable, and so they can become quite isolated. In the school and learning environment, those difficulties with attention can also become a bit heightened as workload gets heavier, planning becomes more important. So it can be a really challenging time for families, but I think making sure that you maintain a good relationship with the healthcare providers that are supporting you, and that includes where medication is part of the picture, making sure that the best choices for medication are considered and reviews are considered as they might need to be, and also other supports and behavioural therapies, and having a good psychologist and the strategies that go alongside that to be helping that situation. But it is a time of added challenge. I think it's really important as well for parents to know that biologically that does settle down eventually, and sometimes we see it's almost a longer period of adolescence for young people with ADHD than might be typical for those without. So some of those difficulties with decision making can extend, you know, well into the teens and a bit beyond. But being there to try and put as much support in place through that process is a really important thing through that period. I don't know if you add anything to that, Emma.
Yeah, that's fantastic. I think the other thing I'd say about ADHD in adolescents is that there are a number of studies that look at, I guess, additional kinds of behavioural therapies that can be helpful during that period. And there's a number of studies that show that supporting adolescents with organisational skills approaches can really help. So helping them to, you know, best manage their time in the classroom, manage homework, have structures around that. So there's a number of trials that have been shown that have shown that is a really helpful approach that can go alongside medication. And I think having some of those other strategies alongside medication is important, because there can be additional challenges that happen in adolescence around whether or not the young person wants to take medication, and that can be another challenging thing to manage. The other thing I'd say is really kind of being on the lookout for any other mental health conditions that might be emerging in adolescence, and seeking help for those early. So whether or not there are any signs of, you know, anxiety or depression, because again, supplementary types of therapies can help with those additional mental health difficulties, because we know that on average, young people with ADHD are at increased risk of those too.
And some of the lifestyle things that come into that adolescent period as well, like sleep, obviously, and diet and exercise, that are good and important for wellbeing generally. Really important to make sure all of that's kind of looked at for young people too.
That's a good point. I didn't mention that. So there is, there's lots of research now showing how common sleep difficulties are in adolescents with ADHD. Also really common in lots of research in younger kids too. Yeah. But we've just finished a small study where we've brought adolescents into the clinic and helped them with their sleep. And we were really surprised at how well adolescents engaged with us and wanted help with their sleep. And it's a new trial that we're starting actually from the middle of the year, which is looking at helping adolescents who have ADHD with a targeted program around their sleep. And that will be, we'll be working with parents as part of that program too. So people can feel free to get in touch with me about that.
We've had a couple of questions about sort of specific options for interventions or potential treatments, and one of the parents has asked whether or not there's any particular treatments that could help specifically with brain development. So I'm just wondering, Peter, if you would want to respond to that.
Brain development. Well, look, there have been a number of interventions that have been tried with very preterm children and preterm children more generally. There's a big focus on early intervention, and there have been many trials looking at the benefits of early intervention, and the overall literature suggests that early intervention is beneficial for children born preterm and very preterm. Early intervention can enhance their cognitive development, but very importantly, it can improve their behaviour. It can reduce externalising behaviour problems, and it can improve or reduce internalising behaviour problems as well. We haven't actually done a great deal of research looking at whether it enhances brain development, but we would think that early intervention would have a positive impact on brain development. Other interventions which may be relevant for individuals who have ADHD, cognitive training interventions. My group and many others have looked at cognitive training with children with ADHD, or children who are born preterm, children with other learning problems. Some studies have found that cognitive training is effective. Some studies have found that it's not effective. But what seems pretty clear to me is that even the studies that show a positive effect, that the effects diminish with time. So I'm not too sure yet whether cognitive training is something which I would be recommending for children with ADHD or other developmental problems, especially given the cost associated with those interventions and the burden required or involved with cognitive training.
Okay. So another question we've had is about those children who may be presenting with symptoms of ADHD or difficulties in attention, but not at a level where they would be diagnosed or not meeting those sort of criteria for ADHD. What sorts of things can parents do for their children in those circumstances? So maybe, Anthea, if you wanted to start.
Yeah, so I think a lot of the things that we've talked about that are important where children do have ADHD are important generally for development and behaviour and attention. So again, things like understanding how that child is functioning in the classroom and where their difficulties lie, and getting assistance from a psychologist can be really helpful with that, and then making sure that the teacher is well supported to actually put in place the right sort of strategies that will assist that child in their function in the classroom. And similarly in the social environment, understanding a bit more about what the challenges are, and then helping that young person to actually work through some strategies that will tackle those. And also thinking about the other things, as we've talked about, outside of those symptoms themselves, but again, like sleep, making sure that that's adequate. Even in those children who don't meet a diagnosis of ADHD, all of those sorts of things are really helpful. And I think it's important to remember that it's a type of spectrum, and challenges with neurodevelopmental issues, so things like attention and behaviour and activity levels, are going to be on that spectrum. And we draw a bit of an artificial line at some point and we say, okay, here it's having enough of an impact that we're going to call it ADHD and we're going to start thinking about all of these things. But those children who are sitting just to the left of that line, they're having lots of challenges too. And many of those things that work well for children with ADHD will also work well for those other kids. And thinking more about what's this child's need and how can we meet it, then, you know, what's their diagnosis and what does that mean?
Christy, did you want to add anything about your experiences about working with schools or in your experience of your daughter?
I think there's still, I think what parents probably need to keep in mind is teachers actually don't get any formal training in dealing with kids with ADHD. So it's very much up to the parent to engage with the welfare coordinator and their child's teacher to educate them about ADHD and also educate them about your child's needs, because obviously every child, even if they do have ADHD, are going to have very different needs. And that's something that I've had to work with the school, with my daughter's school with, just to help them to understand, because they don't get that training for all different neurotypes. So.
Okay. And I'm just wondering if Anthea or Emma wants to add a little bit more about what sorts of supports can children, or might children be eligible for at school in terms of extra support if their child has a diagnosis of ADHD?
Yeah, so it's a great question. The diagnosis of ADHD doesn't automatically come with extra support at school, and really, in order to kind of determine extra support at school, it's usually around other things. So for example, a child who has, you know, really severe emotional and behavioural difficulties may be eligible for support at school, and so if a child has ADHD along with that, they might be eligible, but most kids with ADHD will not qualify for extra support at school, which is really challenging, and that's why what you said is really important around that advocacy role. So I think although formal support may not be available, I think there are things that you can advocate for and speak with schools about. So I think, you know, thinking about the child's individual needs and getting them and having a formal plan, like an individual learning plan, can be really helpful, because it can help you to monitor each term things that have been helpful for the child, gains that have been made, things that continue to be challenging, and having, you know, a meeting each term can be really helpful to review plans. And thinking about how you can have regular communication with schools that is, you know, it's hard to think, you know, you're not going to be able to speak to a teacher for an hour each week, but what's something small that you can do to kind of keep in touch with schools? And I think that's really helpful, because it means that you can communicate what you found helpful at home, and teachers can try similar strategies at school, or vice versa. If the teachers found something that seems to be particularly helpful, then it's something parents can try at home too. And I think just other, you know, there are other things that can happen in the classroom that don't require a lot of effort, but can really help. So thinking about where the child's sitting in the classroom, making sure, and they seem really obvious, but we see them all the time in clinic, like a child that's sitting near the door or a bin where there's lots of traffic. So moving them to places where they're going to be less distracted. And a lot of the kinds of, and I guess a lot of these kinds of strategies can be helpful for all kids. You know, it might be, you know, ensuring that information's broken down for kids, thinking about how to best help children through transitions, because that can be a tricky thing for kids with ADHD. So when they're moving between different classes or moving into the playground, so thinking about how to best support kids in the situations that are known to be tricky. And I think, you know, one of the key difficulties that children with ADHD can have is around regulating emotions. And I think having a strategy in place to help children to be able to regulate their emotions. So if they're in the classroom and they're finding that, you know, they're getting worked up and feeling like they need a bit of time out, having a place that kids can go to that's supported so they can have a break from the classroom. And all of those kinds of things don't require extra funding as such, but just requires an understanding of that individual child. Yeah.
I think I would probably add to that as well that sometimes I've found some parents they're not sure whether they should tell the school all the difficulties their child is having, like particularly perhaps entering prep or at the beginning of the schooling journey, or whether that might mean their child is treated differently or is judged in some way, or they might feel they're going to be judged themselves as a parent, and so they might sometimes feel like they'll just kind of hold that back. But I really do encourage parents to actually try to do the opposite of that, engage with the school and learn who at your school is actually responsible for children with challenges or extra learning needs. It might be the assistant principal, it might be the principal, it might be a wellbeing coordinator or officer. Sometimes the classroom teacher doesn't give the traction or the feedback that you might be looking for, and you need to seek out whoever that person is in the school who's responsible for coordinating those things and explaining to them your child's needs so that they can actually be in an informed place to make as much of a difference as they can within their resources for your child. Because keeping things kind of hidden or not being sure who you should talk to ultimately is not going to give them any extra support, and it means that they won't get maybe some of the benefits they might have if you'd found a way to speak up and actually really engage the right person. Yeah.
I've even been quite honest and tried to educate even my daughter's swimming teachers and her basketball coach, and I've had a really great response from everybody. Just to explain shorter, sharper instructions are going to work best. I think it works well for most kids, but it's particularly kids with ADHD, get to the point, sort of sharp instructions work best for them.
That's a really good point. I was just going to flag just around that. I don't know if you've seen it before. It's called All Play, and it's a web-based platform that has tips for families to communicate to coaches, to make sports inclusive for children with neurodevelopmental disorders. And there's a whole section on there about ADHD, but they have sections on autism spectrum disorder, and just give really good tips for kind of communicating these kinds of things to other people so that kids with ADHD aren't excluded from sports and held back. So that might be something people want to look into.
And I think it also highlights another we're slightly getting off topic, you can rein us in, Carly, but the importance of giving children with ADHD a space to shine and function outside of the classroom where things might be tough, or the playground at lunchtime every day at school where things might be tough. And really getting the school on board with that as well. Is there something that this child, enjoys and is good at? And giving them extra air and energy and time around that thing. And it might be an extracurricular activity, it might be something creative, whatever that is, finding a way for that to become, a prominent part of that child's life, because there's lots of energy put into all the things that aren't working a lot of the time, and all the things you've got to stop and change. But finding something that you don't need to stop or change that's really great and giving that some more attention can often build self-esteem for a child, and those things are really important too for friendships and function and energy. So having a way to keep them included in extracurricular activities and finding something that works for them is a really important other sort of thing to be doing too.
So, Peter, I might direct this question to you. We've had a question from a parent who has a premature baby and has noticed that her baby, who's now 5.5 months corrected, is very active. And this parent's wondering whether or not these kind of really early signs or things that they're noticing could be a sign that this baby might go on to have difficulties with attention or behaviour. How good are we at sort of looking at really early behaviour and predicting things like ADHD?
We're not, especially in the preterm group, where these children do have developmental challenges because they're born early, and so they're often delayed in a lot of areas. So I think I would monitor that child very carefully. Express the mother's concerns with the doctor, hopefully a paediatrician who can monitor that child, and see whether there's other issues going on as well, and see whether together they can just really monitor that child's development over the course of the next year or so. I don't know whether Anthea wants to add to that.
No, absolutely echo that. I think it's really difficult at such a young age to be making any sort of interpretation of patterns of behaviour. I think if for that parent there are certain things that are really challenging about their child's behaviour at that age, then raise those particular things with the maternal child health nurse or your GP or a paediatrician and get some strategies to work around that, whether it's sleep, whether this is a baby who doesn't sleep well, or whether it's a baby who's physically on the go a lot, and how you can manage that for that child. But I think way too early to be worrying or thinking, oh, is this going to be outside of normal, because we've just got, you know, such a spectrum at that age, even in typically developing children.
So we've had a question asking about whether or not babies who were born prematurely are at increased risk for other symptoms of mental health problems such as anxiety, and also, I guess, asking about the sort of potential relationship between anxiety and other mental health symptoms and ADHD. So maybe Peter, if you could talk a little bit about mental health, and then Emma, if you could talk a little bit about the relationship.
Well, we do know that children born very preterm are at increased risk for a range of neurodevelopmental disorders. ADHD is one of them, and that's about, as I said before, about 3 times the rate of the general population. Autism, 4 times the rate. But they're also at increased risk of learning difficulties, speech and language problems, motor problems, including cerebral palsy and developmental coordination disorder, among a whole range of other developmental disorders. But I just again like to emphasise that most children born preterm or very preterm don't have any of those problems. So there are comorbidities. So children who do have ADHD are at greater risk of developing some of these other problems, especially in the classroom, socially. But we actually don't have any, really good evidence to say what percentage of children who have ADHD have these other disorders as well. I know there is information about that in the general population, but in the very preterm group we actually don't have that information yet, and that's because we don't have large numbers of children who have these have ADHD that we can look at these other disorders, which are also relatively rare. So in order for us to look at that, we need to see thousands and thousands and thousands of children to really get that information reliably. But they are at increased risk of anxiety and depression as well. Maybe pass it over to Emma to talk about that.
Yeah, so we've done a lot of work actually in the area of ADHD and its overlap with anxiety. So we did a study a couple of years ago, actually probably, say 5 years ago, time flies really quickly, where we looked at a big group of kids with ADHD. So it was about 400 children in that study, and we assessed whether or not the children with ADHD had an anxiety disorder alongside with their ADHD, and we did that not by focusing on whether the anxiety had been identified, because in many cases it can go under the radar, because I said before that it's not as observable. When we did these assessments of anxiety, we found that about 60% of children with ADHD had either a generalised anxiety difficulty, so just kids that are just general worriers about all kinds of things, either social anxiety, so worry about performance in or performance in academic situations, or worrying about how they're going to go in social situations, and also separation anxiety, so really high levels of separating from their caregiver. And we found that if a child had both ADHD and anxiety, that it did make everything worse, so that the general pattern of behaviour was worse, that the social relationships were worse, and so on. So we've just near completed of a trial where we're looking at helping children with ADHD and anxiety to manage their anxiety using a cognitive behavioural therapy approach. And so in that trial, we're looking at actively providing and working with children and parents around skills to cope and manage with anxiety, and help them with the kind of day-to-day tasks that are tricky because of anxiety. So that's a trial that we've finished, but we'll have the results for that by the end of the year. And I guess the reason we took that path is that it's hard to know sometimes whether or not a child with attention difficulties is going to be able to engage in a therapy like that. But we found that the children engaged so well with us, and the parents, we've had lots of positive feedback, but we just don't know yet whether or not that helped in improving anxiety. So you have to stay tuned for that one.
We've had a couple of questions, and Anthony, I might direct these to you, about medications, and one example of being Ritalin, and what parents wondering about what are the long-term effects of Ritalin?
Yeah, so I think there's, and I think Chrissy, you alluded to this when you were talking about getting information that's factual when you go online. I think there's a lot of worries that parents and questions parents have about treatments for ADHD, and particularly about Ritalin, which is a stimulant type of medication, and so that makes people think of speed and recreational drugs and what's this going to do to my child longer term. Ritalin's actually been around and been used in treatment for ADHD for many, many years, and it's one of the most studied drugs and very safe for children. It doesn't have long-term negative effects in terms of addiction or problems with changing the way a child might develop their personality or their ability to actually regulate and think for themselves. It's very much a short-acting medication that, where there are problems like ADHD, will provide a really clear benefit in that child, and then for others it will make little or no difference. There are some shorter-term side effects to Ritalin that can affect children on the day-to-day basis. The more common ones of those include affecting their appetite, and associated with that, but also separate to it, affecting their growth. So those sorts of things are important to parents, and we need to monitor them and keep an eye on them when children are on medication, and if we feel that they're problematic, then we would look at changing that medication for that child. Yes, hopefully that answers the question for people.
So what would you suggest parents do if they're concerned about or want to talk to someone? Who would be the best person to talk to about that?
So I think really important so Ritalin needs to be prescribed either by a paediatrician or a psychiatrist, and I would hope that they'd had a conversation about that with that healthcare provider when that medication was started. Sometimes I find when I see families, that medication may have been started a very long time ago, and they might have been taking it for ages, and they've got new questions or things that they didn't think about way back then, or perhaps that child is getting older and they have questions themselves now about that medicine as well. So it's really important to revisit those regularly when you're getting another script, to actually go through, are there things here that I need to be thinking about or worried about? And if there's anything different or new about your child that you're worried might be related to the medication, making sure that you bring that up and address it. Yeah.
Okay, thank you. So I know, Emma, you mentioned a program that involved parents. What can parents do to get support for themselves and their family if their child has ADHD? Where would you suggest?
Yeah, so I think it's really important that if parents are struggling with managing the child's behaviour, or even, you know, if there's any concern around how you're feeling and whether you might, you know, be feeling a bit low or really stressed, it's important to get help for yourself too. And it's really tricky because parents are so busy and it can be hard to fit everything in. So when you're going to see someone for your child, and you've got other children and all kinds of things, but we know that if parents are looking after themselves, it's going to be easier for them to manage, and that's going to be the best outcome for kids too. So the first place to go would be to see your GP for a referral for any support that's for yourself. But if it's about supporting your parenting alongside, you know, in relation to your child's ADHD, then speaking to your paediatrician or psychologist about that. But when I say kind of supporting your parenting, it's in the I just want to be clear about what I mean by that. So because the behaviours are so challenging to manage, you might need extra support to manage some of those behaviours. So it's about, and if you think about if you're and I just think about the clinical work that I do when I see children, and when I'm dealing with a really high energy child for an hour as a psychologist, I find it tiring. So I always think, if I was doing this all day, you need extra help and resources. And I just see it as like a little bit of a boost. You know, what are some additional strategies that we can use to help? So for something like that, the treating practitioner that you're seeing, so whether that's a paediatrician, they might be able to refer on to a psychologist. The other thing that there are a number of, other programs that we're looking at the moment. So these are new ideas and programs that we're trialling out, but one of the areas is in mindfulness, and looking at how we can help parents to have a little bit of time out each day, even if it's just 15 minutes, that's around more of a mindfulness kind of meditation kind of approach. And that's something that we're trialling at the moment to see whether that's helpful for families, because surprisingly there's not a lot of research about the evidence for those kinds of approaches, but we think that it could be a really good idea. So that's something else that we're looking at too.
Yeah, we do quite a lot of meditation.
Yeah.
I think that it's a huge part of treatment, as well as being able to regulate your own emotions. I think that it's a very big part of the treatment. I think it's also important to reiterate having the right support network around you. Sometimes you may have to lose that person who doesn't quite understand, because at the end of the day, it's about what's going to work for you guys. And I think that you need to have a really strong understanding support network around you. You don't need people who are going to still think that it's bad parenting or something like that.
Thank you. Did anybody have any, final thoughts about, I guess we've talked a lot about where parents can go for help. Did anyone have anything else that they just wanted to add about support services or resources for parents?
I guess I just wanted to reiterate just the idea of being creative around some of the management approaches. And so we were talking a little bit before about supports in the school that can be helpful, but really thinking about what the child's interest is and how we can best engage it within the school environment. And so, if the child has a particular interest in, a particular animal or, planes or whatever, thinking about how we can be creative with incorporating that into some of the learning exercises that we're doing and reading and so on. And I'd encourage parents to think about any approaches they can discuss with the school around evening the playing field. So can we think about creative ways of doing assignments where kids might develop a website or a video about what they're doing, or maybe it's about being able to take a picture of something from the board rather than having to write everything down, giving kind of things written down for homework rather than relying on kids to putting it in a diary. So I think being as creative as possible and thinking about what you find as an adult helps you to be organised and pay attention. Often the same kinds of things that we're trying to get kids to do. So they're the same kinds of approaches, but giving kids that chance to really engage well and make school fun, I guess.
Okay, thank you.
I'm not sure how much time we've got left, Carly, but yeah, definitely echoing that, Emma, that it's, if you imagine something that's hard for you to do or that you're not that interested in, it takes a lot of work to stay engaged and pay attention. And maybe there's someone listening who's interested in immunology, but if you're not, most of you probably aren't. If I sat you in a lecture theatre and got you to listen to that for an hour, you would rapidly feel exhausted, disengaged, probably not want to go again. And I think with children with ADHD, often trying to maintain their attention is such hard work for them, and they're working hard at it, that whatever you can do to make it a bit easier or a more pleasant experience will make all of that better. So those creative things are really important, because keeping them engaged at school is so critical to them doing well.
I just want to say something really quickly actually about that. Don't yell at me. It's just that I think a misconception can sometimes be that children with ADHD can't pay attention to everything, and that is not true. So children with ADHD can often pay attention to something that they're highly interested in. Yeah. So, if it's a TV show that they really like, or Lego, or something that's really highly engaging to them, they can pay attention. We think about ADHD when it's more around difficulties paying attention to those other things that we all have to pay attention to get through daily life. So if you're thinking that, oh no, but my child can pay attention in this one specific area, it's worth still thinking about the other aspects for that child. And the final thing I'll say is to try not to sweat the tiny things. So if a child's moving around a little bit, fidgeting, it's probably not doing any harm, so let them. And by not giving negative feedback on that, it's really ensuring that we're not ensuring that we're preserving the self-esteem of kids. So really thinking about what the big things are rather than the little things that probably aren't having an impact.
Okay, thank you. So I think that's all we actually have time for today. So I'd just like to thank everybody for sending in your questions and sharing your stories with us. Thank you to our panel members, so Anthea and Christy, Peter and Emma. Thank you to all of our partners and collaborators, so Life's Little Treasures Foundation, Murdoch Children's Research Institute, Royal Women's Hospital, Royal Children's Hospital, Monash University, Melbourne University, Deakin University and La Trobe University. And if we weren't able to answer your question, we're going to be trying to answer as many as we can on the Facebook page straight after this session now, so stay tuned there. And also on our Facebook post, there's also a place where we've got a short poll, and we'd really love for some feedback on today's session. So if you have any feedback, please let us know. And also if you have any ideas for future sessions that we could do for our Prematurity Roadmap series, we'd really appreciate your feedback there. So thank you.